A very good evening to everyone. As usual, before we start on, here is the cup, the signature cup, and a beautiful evening. It's all coffee, of course. Thank you for joining us at Kopi With Vans again. It's been a very, very interesting past couple of weeks where we started our Tuesday live shows as well on a lifestyle. And Wednesday will be, as usual, our health talks with our experts and professionals, especially on special populations, even when we talk about different aspects of medicals or even health or even COVID. As you all know, that it's been running over past couple of weeks where we increased one more session. So thank you so much of joining me at Kopi With Vans. And of course, today we have a very interesting topic. It's quite interesting. I have our guest speaker here right now. He'll be joining us in a couple of minutes. It's not a new face at all. I mean, he's been with our Kopi With Vans, a regular guest speaker. It's a very good friend and a great doctor as well. I mean, he covers in all aspects. That's none other than less Dr. Arinder Singh, HS. He'll be joining in a couple of minutes. He had a very hectic schedule, so he's joining us from Malaysia itself. But the interesting thing about today's topic, I think over the past 1 year, we've been talking a lot of woman empowerment. We give a lot of the credits to the woman. We talk about a lot of physical abuse, mental abuse. We talked about the rights, a woman should be in the kitchen, and so forth, right? We talk a lot about lots of topics about that. I think easily about 7 or even 10 over topics. But today it's going to be a little different. And if you look at our topic itself today, it's going to be men's health. And I think we do need to give the men out there some credit as well. In fact, not some, I think lots of credit. Since today's the topic is man health, we're going to cover a lot of other different segments on today's talk show. If you are watching this, so please do share, because we want to reach out to many men as well. So to show that Kopi With Vans is not only talking about women at all, not just women herself, but of course to the men. But before I'm going to invite a couple of guest speakers today, I have a few who already want to jump on board and give their views. So hopefully they do join us on the later part of the show. But I think the interesting topic before I pull Dr. Arvinder up is men seems to be always be the tough guy, even when we talk about the family or even for the for whatever matter it is, right? You can never easily see a man melt down. But to be very honestly speaking, as a man myself, of course, no doubt about that. Of course, looking at a beheading kind of stuff, I think men do tear down at some point of time, right? They do fall into a lot of other categories, but they most of the time they don't seem to see weaknesses, or rather show any weaknesses in their body. That's one of the reasons why, because I think they always want to show the alpha. All right, they do not want to show at all the weaknesses at any point of time, and that's one of the things that we talked about today, earlier a couple of days back, that we want to give credit to the men all out there. So without any further ado, I'm going to bring in Dr. Arinder HS Singh Hello, Dr. G. How are you, sir?
Hi, Vance. How are you, Vance? I want to correct you. Actually, it's
Yeah.
already been a year plus. In fact, we are just a few days shy of me coming on your show for the first time, and I think it has progressed tremendously before, and from before, you're getting much more fans and views. And big hand to you, bro.
Thank you,
Well
thank you,
done,
Jay,
man.
thank you, thank
Well
you.
done.
I mean, that would not be possible without our viewers. I mean, I think the correct amount of content is coming out, awareness, the consistency is
Yep.
all happening. So, thank you to you also, being a regular speaker at Kopi Events.
Unbiased and fair views for everyone. Yep.
Thank you, doctor. Thank you. So, doctor, I mean, of course, today's topic we do agree that we want to give some credits to the men out there, especially during not only during this pandemic. I mean, we did discussed, and of course, we not have anything concrete to talk about. But today we are going to talk all about men. And of course, we have a few guest speakers who want to come on board and share their views as well. So probably that will be the later part of the talk session. But let's get started up. Let's get, like I said, warm up the car first before we put into first gear. Not just jump into the car and put fifth gear, right? You can't. I mean, you can, but eventually not good for the car. I mean, not good for the body, the mind. So, doctor, so let me just get you started up. I know you also need to get warmed up as well. So when we talk about men, I don't know. It's personally my view. I've not seen men empowerment at all because they think that men are always the tough guys. They will not melt down. They're strong. They are always out there to hunt. It. I think it has changed. We do see lots of cases, but we don't want to go into a particular case that we want to talk about certain things. But what is your view on man itself about man empowerment? Do you think it's necessary or it's not necessary?
I think it's vital. I think Vance, one thing we have to learn is from time and immemorial, we have been seeing that everything is male empowerment. The male, it's always a general cliche that the man has to go and work and the lady stays at home. I think it is not at all accurate or correct in this day and age. I think both have equal roles to play in. I think both, although they are anatomically different, but I think their contribution to society is about equal. Of course, we are seeing more ladies coming into the workforce, more ladies going into many different fields, which I am very welcoming of it. But I think one thing we have to remember is male health is a problem which we have been noticing. I think even in the UK, if I'm not mistaken, only about 5 or 10 odd years ago did they actually started to talk more and more about male health needs. Just to break the ice, Vents, sorry, I have to get a bit anatomical here. You see that ladies normally, whenever ladies have any health issues, I'm talking about physical health issues. Of course, we have the term of physical issues, of physical health, mental health. I'm just talking about physical health because mental health, I think, both are equally prone. Even though the ladies are more, I think they seek help better. The male, as you have mentioned correctly just now, they tend to try to hold on, or they try to show that that they are dealing with it, but that only makes it worse. But physically speaking, ladies normally they either get the problem at the top half of the breast, that means the breast portion, or in the genital area. But males, most of the problem happen in the genital areas. Now this is, although everybody thinks that, hey, this is what's so great about that, actually it is, because when we notice medically, when a lady comes for her mammogram, or they come with a breast lump or anything like that, they decide to get treatment immediately. You use that as an opportunistic screening to ask the lady, hey, actually, madam, have you had your pap smear done before? Have you had your, the cervix smear or the pap smear done? And then you actually also start diagnosing whatever cancers and all that below the belt. But males, everything is below the belt. So what happens is you don't actually have men walking in, coming and saying that, hey, I have a problem XYZ below the waist. In fact, most of it is a lot of genital screening for males. And unfortunately, I think in this part of the world, it's a bit taboo at the moment. And it's very difficult for males to come out. And so I don't think it is a problem of, I think awareness may be there, but I think the problem is coming forward. A lot of them are having issues coming forward because of the way our society is built around, and what of our social and cultural norms.
Well said, Doc. But then again, is it could be the reason? Of course, we are going a little bit more as is we're getting warmed up a bit. That weakness is a kind of. I mean, um, I rather say if a man tears down or at some point of time in their life, remember, I mean, we all the same human being. I mean, yes, living in the same earth, but it's just that the way that DNA works is a bit different from all of others, right? The way we function and all that. But at the end of the day, the heart, lungs, the kidney, the endocrine system, the brain, everything is the same. But what's interesting is it if a man melts down or for certain reason if he tears, is it a sign of a weakness? Is that a weakness? Is that one of the reasons why a lot of men tend to be always the alpha, always try to be strong in the outside, but inside they are extremely low in terms of even. I mean, it's okay to tear, but is that could be the reason that they don't want to
I
show
think
weaknesses?
I think it is a cultural norm that the male supposed to be tough and strong. They have to show that exteriorly, the way people expect. You get males these days, when one guy is trying to discuss something, and then the other guy will come and say, hey, come on, like, you're a guy, la, stop doing this, that sort of thing. So what I'm saying, like, bro. So at
Yep,
the end of
yep.
the day, I think that thing is ingrained and inbuilt. We have to understand that physical differences with males and females come because of our hormone production. So of course, the ladies have estrogen and the males have testosterone. So because of all these type of features, what actually happens is the risk of having any other diseases like heart diseases and all that is actually more in the males than in the females. But of course, when ladies undergo their menopause and all that, they have a lower conversion of estrogen, and what happens is the testosterone builds up. So there are a lot of other things that happen. So I think it is more of what society has ingrained into people. I don't think it is more of what the male is actually built or how the lady is actually built. I think it is more of what the society has ingrained and what society expects. And I think that going on shows like that to talk about these type of issues, we can actually change the mentality of society to be more accepting that, look, at the end of the day, we are all humans. All of us are humans. We are all born equal. We all have the same tendencies for many different things. So if a lady can actually cry because of certain things, that upsets, it can upset anyone. A certain event, for example, losing a loved one. Does it mean that it affects more the ladies than the male? No. But because of cultural norms and what has been ingrained and inbuilt, the male handles it differently, the ladies handle it differently, which I firmly believe is where the mental component comes in. It doesn't mean that the lady is not strong mentally. I think it is the male who is actually keeping it up like a pressure cooker inside. It's coming like a pressure cooker, and then it is just waiting to burst. So we must not let that happen, because as we know, and in the past we have spoken, where mental health is concerned, the faster you get medical help or you get treatment, that is when you're actually starting to resolve much faster. It actually is a shorter space of time. So I think it is more of ingrained and inbuilt by society. I don't think it is. I don't think it is actually. I won't say it's cultured naturally. I think it is society.
But having said that, Doc, I mean, we all know that even when we talk about social media or even for the matter of anything, any topic that we always talk, we always give the credits to the women. All right, of course, to all our viewers, I think about 60% or 70% of them are female will join us on regularly on the Kopi events. But we always talk about women empowerment, and I do agree it is much needed. But when we do a comparison, right, there's not much of a men topic at all. I mean, there are a lot of areas that we have heard before, right, in terms of mental resilience or even for the matter of emotional breakdowns do happens if one is not checking on their particularly their hormones or even in their medical checkups, or even when we talk about fertility or even the matter of hormones or even their sexual activity also plays a very important part. I mean, that as we go on, we talked about that's also what we call the self-care, and that is the reason why we came up with the topic of a man's health as well. But let's dive into a little bit on science and the human body and the functions and all that. So we know that, as men, as age, unfortunately, we say we gracefully we age, but I'm not too not too not very honest about. Yeah, I mean, you do have wrinkles. You get a midlife crisis. You want to tend to look much more younger, and you do all those stuffs. It's just a kind of a denial that sometimes we just have to agree upon. But because of the social pressure that we always face, always have to be better than others, have to be run faster than others, so you always try to reverse aging. I mean, we all know that we eat healthy, we exercise, we dress up, and we take good care of ourselves. That's why one of the topic that we want to talk about is about self, looking inwards rather than outward. But doctor, can we dive in a little bit on hormones as we age? Men do reduces their testosterone. That
Yes.
can actually lead to muscular atrophy, which is called muscle loss. Atrophy is muscle loss, and eventually your functions, or even for the matter of your posture, you can't be faster. You cannot be functioning well. You cannot live much more stronger things, and you tend to get, instead of reversing aging, you are going forward 3 or 4 times faster. Can we just talk a little bit on the hormones part, doc?
Well, man, I think I have to just say that I don't think that you age faster or anything, but basically you don't actually physically perform as how you used to when you were younger. Let me just backtrack a bit. One of the reasons why a lot of men actually come and get help is because, not because they want to, either they are pressured, okay, to this as a last resort, or number two is their wife or girlfriends actually ask them to come and get help. So it's always like that. It may not be sexually related. It may be just due to general health per se. But you find a lot of males who come in with this problem. The other thing which I want to actually say is, ladies normally undergo something called menopause. We all learn that. We learn in school, we learn in science, but nobody talks about andropause. Andropause is basically a male menopause where the level of testosterone actually drop, and then actually you lose your male characteristics, where basically there's loss of hair around the armpits or even the chest area, shrinkage of the genitals. Basically it is emasculinization, basically, if you talk very crudely. But at the end of the day, what actually happens is emasculinization happens, and there is an andropause. But a lot of males take it, and when they go and talk to other males, saying, "Well, why is this happening? Huh? You go and talk to your elderly." A lot of elderly men, the grandfathers say, "Hey, this is normal. What do you expect?" Unfortunately, it is not normal. When you have a lady who has menopause and she goes and talks to another lady and say, "Hey, my periods are not regular and all that. Hey, you may be having menopause. You better go and see your doctor and your gynae and get something checked." That is the right attitude. Unfortunately, at this moment, we don't have enough advocates or people to actually talk about it because the subject is taboo. Because the subject is taboo.
Yep.
You see, Vance, even when we talk about men's health, most of the time you'll actually find that ladies are actually coming and attending. Why? Because they will go and advise. I'm nothing against that. In fact, I hope that actually they go home and advise, because that's the best way to actually reach out to them. But you're right, because what actually happens is a lot of them start getting upset, and it affects their mental health because their muscle bulk actually drops, as what you said, muscle atrophy. Their performances. I'm not only talking about sexual performance, even work performance, physical performance, all of that, everything gets affected. And I don't like the fact that, when you talk about males and then you talk about testosterone and then you talk about, okay, we have to do testosterone replacement when it's low. Oh, no, it's a steroid. It is no, it is a bad thing, because of all the bad publicity that we have been getting, because of testosterone is used as a spot doping sort of thing, to enhance and all that. So a lot of people have that. On the other part of it, you have a lot of people trying to go online and say, "Hey, this boosts my men's health," and they decide to buy that, not knowing that there's more content of testosterone or steroids in it that makes the situation even worse. So I think, it is a chicken and egg story, but basically I think it is something which it is much more only than hormones. I think it is also talking about the anatomical structure of the males, the sexual function of males, because you have a lot of times when we talk about ladies health or women's health, we say that ladies have two breasts, they have two ovaries, they have a cervix all to look after. But you can also bring back the same to the men. They have two testicles. They have a prostate. They have a penis, which can cause a lot of issues as well as erectile dysfunction. Although it is more placed south, but it is just as much of problems that you can have within all these structures compared to the lady. So I think, why do we actually see much more? Okay, when you look at statistics or data, you will actually find a lot of people talking about, oh, cervical cancer, breast cancer, but very few talk about testicular cancer or prostatic cancer. Why? Because they're not screened.
Doctor, I think you are actually on the spot on. I think is the social pressure. I got to say that, and also I think it's lots more to play with the ego. I think ego. I don't know. I'm not a big fan of ego at all. I'm a simple jack. I think when you have ego, you don't want to show your weaknesses. But I think it's perfectly fine if you want to show your weaknesses towards your family. I think, of course, if you don't want to show to your society, I think that's perfectly fine. I mean, this is just my perspective. I mean, some may have a different perspective, but I think the more you keep inside, it's just like a vacuum that you're
Pressure
creating
cooker.
in a bottle, and eventually it was shattered into millions and millions of pieces. So I think it's very important that we turn inwards, and that's why in our previous talk sessions and coaching sessions, we always talk about releasing it out there. It's perfectly fine to tear. Doc, I just give you an example. One of the therapy that I do to keep my sanity and
Mm.
my mental resilience, my physical activities, that once in a while I force myself to tear. And I think tear is not a bad thing because you release out that a little toxin that might be involved at certain point of your body, that you just have to take out that emotion out. I mean, we all always look happier. We tend to wear different kind of masks, but I think it's sometimes okay to let go. Just to let your tears flow. And if I remember clearly, I just want to share this with the viewers and of course with Doc as well. I think we are perfectly fine to go back to our past. It's perfectly fine to go back to your past, but the only reason should that we go back to the past is to rekindle the emotional love that we have lost someone. Let's say if someone lost someone, and you're perfectly fine to go back there, rekindle the love, and then come back. Or memories that was created beautifully, you can go back to your past, but you don't want to go back to your past to rekindle something that was very sour, because then you can live within the past but at the current moment. It's going to be a little contradicting here, because you are living in the present, but their mind and body is all in the past because you rekindle it. And I have said that many times in my talk shows that our millions and millions of our cells, and when we talk about the hormones that we have, it's just like a melodrama that your body actually reacts to whatever we feel. I give you an example, Doc. So if I have a situation that is full of negativity and a lot of toxic people around, if I blend myself into that, you are always a group because you are seen as a group. So you must have the courage, you must have the resilience. It's a mental reframe work that we always do, that you got to stand out of the crowd and you got to have your own perspective. That's why I call it the three stages, which is you snap out of it, you focus on it, and you press on. By doing that, one can actually refocus the mind and be super active on the current moment. But some people would just it's pretty hard when we talk about reframing the mind or even restructuring the mind, because they're so adamant to it. Something they listen, there's nothing much we can do. Imagine, Doc, if someone fall into a pit, right? We can tie ourselves and dive into the pit and give the hand and say, come on, hold my hand, I pull you up. But if the particular person doesn't pull up, then obviously it's going to be a very tremendous, not a very good thing to end. But
Yep.
that comes to our current topic, that it is very important that we have to show our emotions out. Not in the anger motion, but I'm talking about emotional emotions. Your emotional emotions that you need to just to take it out, because sometimes it's fine to cry, but somehow or other, I think when the ego comes in, people tend to, like, I'm good, I'm strong, I won't break down. But that eventually will melt you down because you're not able to take that out. What is your take on that, doctor, in terms of medical background?
So I think there are a couple of things here, like Vance. Number one is people who don't want to show emotions. I think there are two categories of people. There'll be one person who uh, can doesn't want to show emotion. The other one is somebody who cannot show emotion. So because they have been so accustomed to it, So what actually happens is, I think in the end, it is a way of whether you, I agree with you, it's whether either you let go, that means you actually share the emotions, or you find a way to drain that emotion. So I deal with a lot of patients, especially with mental health. What they do is they say, doc, I've tried all this, I've tried to talk to myself and all that, I can't seem to snap out of it. So these are the people who actually have trouble even showing themselves emotions. So what they can actually do is they need to work out, or they need to find a way to actually drain that energy up. They need to find a way to actually express it differently. Some people, they want to go and squash, they go to squash, or they want to go to tennis court. Why? They cannot play tennis to save their lives, but what they do is they give a hard smack, they smack and they smash and they smash, especially in squash. Or some of them, they just want to run until they cannot run anymore. So what happens is, it is a mechanism of release, it is a mechanism of expressing themselves. So you can find some people that when they can't emotionally express themselves, they go, they run. You see, that day they are very vigorous in running, and if you normally ask them, they say, yeah, I had a rough 1 or 2 days. That is how they express their emotions. But I think at the end of the day, we must know that there is nothing wrong, and society must accept that men can also break down, men can also have some emotional stress, men can also tear. I mean, if God, if God meant for men not to actually cry, we wouldn't be having our lacrimal sacs and all that. Of course, that is all for tearing of the eye. It's basically is for the eye health. But again, it wouldn't be triggered with emotions, right? But it is. So I think at the end of the day, it is something we all have to accept, and we have to find our niche of how we actually deal with this type of things. I know some people, the only way they can deal it is with, they actually, they have to shout it out, but they can't find anybody to shout it out. So they have to
Okay.
find a particular big space and then they have to shout it out. I see people, they have to laugh it out. They have to laugh it out,
Yeah.
but they cannot laugh because if somebody is scolding you in public and you start laughing, they'll say, hey, there's something wrong with this guy, right? So they have to find another outlet to actually, and that actually causes problem because they can't find that outlet. So I think it is basically a finding, your area of how you release it, basically. Yeah.
Okay, Doc. We have a question that come in, but we will definitely will take it as much more later on the later part of the show. But right now, I have a viewer who want to come in on board. His name is Ashwin
So
Siva. He's going to talk a little bit of experiences of his and what he have observed being a man. I mean, sometimes it's very hard to talk to make a man talk. I mean, I think it's because of the nature, it's because of the hormones and chemicals within us. We are always comfortable talking about our strength, our achievements. Sometimes we don't even want to talk about our failures. But I think, like I mentioned earlier, I think it's perfectly fine to go back to your past, but do not stay there. Rekindle the love back, rekindle the emotion back, come back to the current state, and you can live blissfully. But I'm going to bring in Ashwin Siva here to hear his views and points on men. Let's get Ashwin. Ashwin.
Hi, Dr. Aravinda. Hi, Brother Vance. How are you guys
Hi,
doing?
buddy.
I
Thank you
hope you
so
guys
much.
can hear me fine.
Thank you. Thank you so much for joining back at Kopi With Vans. And I know you have some valuable inputs on men as well, being a man, we men.
Yes. Yeah.
So what is your take, bro? I'm not sure if you have heard the past 30 minutes of our
Oh,
talk
yeah.
session.
Yes, I have heard everything that Dr. Aravinda has been talking about men's health and most importantly, men's mental health,
Okay.
which is exactly what needs to be talked about besides the physical health element as well.
Okay.
So, as from my experience, as someone who has hypothyroidism, so I really feel all the stuff that you just described. You know, the ups and downs, this kind of thing, the lack of energy, this and that, what have not, and what have you. So, in my experience, this is what I've experienced from hypothyroidism. It's not easy to talk about it. You try it; very few men actually have it to begin with. Usually, it affects postmenopausal women, from what I gather. So, what's your take on it, doctor?
actually, hi Ashwin, hope you're keeping well. Ashwin, actually, I'll be very honest with you, and I always like to use the term of hypothyroidism. Hypothyroidism can affect anyone, and it shouldn't be a stumbling block. You know who is the world's most famous person with hypothyroidism?
No, I have no idea.
Any idea? Lionel Messi.
Oh, really? Lionel Messi?
Yep.
Okay.
He was diagnosed with childhood hypothyroidism,
Hmm.
and that is why he has his affinity and love towards Barcelona, because they actually paid for his treatment. And you
I
see,
do
it
remember
doesn't
that. Yeah,
stop a
treatment.
person from becoming the best. Yeah. So I always say that it doesn't stop a person from becoming a better person, a person who is maybe the best person that they can be, or a best footballer in the world. It is all treatment per se. But I agree with you that hypothyroidism can play a role in imbalancing a lot of chemicals and hormones within the body, especially when it comes to mental health. There are a lot of people who come to see me who are having symptoms of hypothyroidism, and I honestly, I can tell you, I pick up about at least 3 a month, and
Wow.
it's a very uncommon thing. You will see a lot of people saying, you pick up 3 a month, that means you're getting like 36 a year. I said yes. Why? Because we screen for it. So as I say, it is basically something that when you look at and you say, something is not right, it may be an endocrine disorder. So we get a few patients who come with hypothyroid, and I think Ashwin, you may know that the treatment is actually very, very simple. It can be done with 1 tablet a day, or 1.5 tablets a day, and you're more or less done with it. And I think it is basically an awareness. But I think hypothyroidism doesn't only affect males, it affects ladies as well. But you're absolutely right, sometimes it is very confusing, and it can also affect a lot of male disordered related hormonal and also functional problems. So I think it is all lumped in one. I hope you're feeling much better now, Ashwin.
Yeah, I'm actually not on medication. I was advised against it. Yeah.
Okay, but how are the levels right now?
I can't remember. The last check was probably last year, but I have to probably go for another check again this year.
So there are
So
multifactorial things about medication. Some people want to go, some people don't want to go. The reason is because it may be, that means your hypothyroidism may not be as severe as thing. And I think you have brought up a very good point there, Ashwin. A lot of male disorders or even endocrine disorders, hormones, it doesn't mean that you straight away go on medication. Sometimes you can actually there are certain ways you can actually do to increase. I'm not saying all the time. When I'm talking, you're talking about borderline cases. Let's talk about cholesterol problem is also sometimes known as an endocrine problem. If you're on the borderline, you can actually still try and do exercise or try and maintain that. Sometimes if you find that your thyroxine level, which may be that means you may be having a high TSH and low thyroxine level, but it's near borderline, they will say, you know what, you can actually maybe eat more certain type of foods to actually increase your thyroxine levels. I don't know about Singapore, but in Malaysia lately they have made sure that all salts are iodized salt, so that also helps in particular sort of way. Partially, not completely, but partially. So I think at the end of the day, there are a few things. Of course, sometimes when we see that it is very severe, it's already affecting the patients very badly, we recommend them to go on medication. But it's a very good point which you have brought up, because the most important thing is we have to identify the mechanism of what is wrong and what is the mode of treatment. Unfortunately, a lot of people, they decide to straight away go on medication, or they try to go on one particular therapy trying to hope that it works, or they try to go on exercise or some other form of thing, or taking certain supplements or foods hoping that they sort this disorder out. But unfortunately, what happens is the situation becomes worse. So it's good that you are under a follow-up of care of a medical practitioner, which is more
yes.
important, and observe that, which I think is on the right path.
All
Thank you,
right.
Dr. Arvinda. I got a question for Ashwin Siva. I think
Yes.
that's going to be a little bit more deeper into the man perspective. So
Okay.
what do you observe, bro? I mean, do you find that is it okay for men to make tears, or even to cry, or even to show weaknesses? What is your take on that?
I think it's important to do that. I think, but it, like you said earlier, whether you show it to whom you show it to matters also. Uh, it's a perception thing, and from because I think human beings are human beings, and the fact is we all have brains, we all have emotions, we all have hormones. So, like Dr. Arvinda was talking about hormone, about endocrine situation like hypothyroidism. Yes, it affects my hormones, like putting on weight, losing weight, putting on weight, losing weight. For me, that's the biggest issue that I always get because I'm not on medication. So, yeah, I do agree that men should have an outlet, and an ability and also the platform to showcase their emotions that they're feeling. Because I mean, we see it in society everywhere. Guys just flip out. You know, we have seen cases. You know, or it boils up, like you said, like a pressure cooker, and eventually it pops and explodes. I think identifying the signs and I think expressing it is very important for men, and I think it shouldn't be frowned upon or shouldn't be laughed at. I think it should be encouraged. Yeah.
But I'm just going to push a little bit, divert on that. Also for Ashwin Siva. I mean, of course, you're coming on board as a guest. Do you think that the weaknesses is about men showing it out, and that's one of the main reason? Of course, I mean, pride, respect. I think I'm not a big fan of ego at all. I'm against it. Do you think that could be the reason why men are always do not want to show their weaknesses? I mean, of course, they want to show their weaknesses to their loved ones, fine. But is that one of the reasons why they don't even show to their loved ones? Right. And I think most of the time it has pushed them to a certain, even in the psychology aspect, if you're looking at it, I'm very keen in the psychology aspect because I'm currently pursuing studies on psychology. So that creates me a lot of interest in the human mind. But do you think that ego is may one of the problem that actually keeps man away from the reality and put a different mask at the same time, not showing their real self? Do you think that could be the reason as well?
Two reasons. My feeling is two reasons. One is the concept of masculinity, and men try to maintain their masculinity. Number two is culture. We have a culture that does not actually accept or allow men to have this kind of platform. And I think in Europe, they're doing a better job at this compared to Asia. Asia, still, we have this Asian kind of mentality. The guy has to do everything, you know, that kind of stuff. But, you know, that's changing in Europe, it's changing in the US, it's changing in Canada. So they actually is not frowned upon to go and seek help in the mental form. And there, it's not even frowned upon. It's in fact encouraged. While here, it's not.
Yeah, and the reason for that is because of gender equality. You know, gender equality doesn't mean that you're only bringing the ladies up. You're also at the par where you actually recognize that a lot of things which are happening to the ladies are also happening to men. In the past, you will hear, in the past you will actually hear a lot of people being women being battered. Even in I think this part of the world, in Southeast Asia, you hear a lot about that. But when you go a bit to the west, you will hear the other way around: men being battered by their partners, whoever their partners may be. And I think at the end of the day, it has come to an equilibrium whereby we realize that healthcare is not only perhaps very gender specific. If we look at a person as a human, because to be very fair, we are coming now, and because of one of the points you brought up about hormones, we also must understand that we are having different genders these days, different identity of genders. That means, you know, when you fill up a form, when anywhere, I belong to many societies in the US and UK, whereby when they fill up a form, the way they ask you is, what is your birth gender and how do you currently identify yourself? Whether you are a male or whether you're a gentleman or you're a lady, and what is your birth sex? That means you're male or you're female. So at the end of the day, you know, society has been blending that way. I think one of the good things we can pick up from that is that I think the way a person can express themselves has already changed. So I think that has allowed a lot of emotion from the males as well, and it is nothing. I think it is, we are breaking from that trend where you know, the male must be the hard type of people where they can't break down. They are the stone wall of everything, but people keep forgetting that they are stone wall made out of flesh, and flesh gives way. So
exactly.
Yeah.
That's a good point.
Dr. Arvinda. Thank you, Ashwin. I mean, do you have anything to add on, Ashwin, before we say goodbye to you?
Oh yeah, I mean exactly what you guys are talking about. I have to fully agree, and I just think that we should have more of this kind of conversation with guys, and guys should be a bit more. Don't be afraid. Just seek, and you shall find. You know, as the saying goes. And if the more you hide it, it's just going to get worse. So any issues, they should just talk about it seriously. Yeah, in my experience, I think it really does help.
Thank you so much, Ashwin Shiva, for joining us.
You're most welcome.
With Kopi With Vans and giving your honest opinion, and very truthful. about yourself, about a condition that you shared. We wish you all the best, and we can take it. We can talk it on a sideline. I mean, how what are the things that you can actually improve in terms of hyperthyroidism and what kind of exercises? I'm definitely be happy to talk about that later. So do contact
Sure.
with me so we can get in touch with it. All right.
Of course, lah, bro.
Thank
Thanks,
you.
Dr.
Thank you so
Aravinda.
much, Ashwin. Thank you, buddy.
Thanks,
Thank you so
guys.
much.
Most welcome, bro.
Thank you.
Stay safe. Be well.
Thank you. Bye bye. Okay, Doc. So that was Ashwin's honest opinion. I mean, talked about the things that what is going to. I mean, it's good to have different voices coming out so that we can actually understand, right? Not always the both of our voices, but we are going to go to the second gear itself, which is the most, I think, a topic that they don't want to talk about. All right, that also because it's very sensitive, a lot of shyness, and even for the matter of that is, one if falls under that erectile dysfunction, they think they're not manly enough. I mean, of course, this is all have to do with science, not only medications, but in terms of I think DNA plays a part. Genetics also could play a part. So, what is your take on these, doctor? And if someone who is suffering from this, rather going through this erectile dysfunction, what can be done? Is there any hope for them? Because that could be also bringing down their morale, their confidence, their determination, and even the alpha thingy in them. You can start to break them eventually and become emotionally stressed. What is your take on that, doc?
And their mental function, the breakdown of their mental health as well. So I think one of the more important things we have to understand is basically erectile dysfunction. Unfortunately, in this part of the world, now I have some experience of working overseas in the UK and also in Malaysia. You find that it is very different on the way the approaches are happening. In the UK, they actually come quite openly and they come quite early, stating that I'm having this problem, and they seek help. Unfortunately, in this part of the world, we have to use it as an opportunistic screening. I'll give you a very fair example. I have to ask, and I make it a point to ask all my diabetic patients and hypertensive patients when they come in, at least every 2 or 3 months once, asking them about whether they have any erectile dysfunction. And more often than not, a lot of them are shocked, they are surprised, and a lot of them end up asking me, "Hey doc, why you ask me?" And I tell them, look, it's very common to happen, especially it's very common to happen if you have a high cholesterol, you have hypertension, you have diabetes. There are a lot of things which can actually cause this. And they will say, actually doc, I am having an issue. And you will be so surprised that there are so many people out there. And when you tell them, hey, actually diabetics, it's very common for them to have this problem, and they'll be like, yes sir, really? Yeah. And then you know what, they go and ask their friends who are having diabetes and all that, and they just have a one-to-one and tell them, hey, do you have this problem? And they say, yes. Oh really? You also have? I never knew about it. I thought it was only me. I think it's because of the problem is, number one, it's a topic below the belt. As I was telling you, most of the male problems are below the belt. So I think it is a taboo, especially in our society, to talk about this type of things, especially in the open. And number two is, I think, the shyness of it. And again, I think it's a lot with what you have to say, what you said about Vans is about people being alpha, or males being alpha, stating that they had to be good in everything. They have to perform at optimal levels in everything. Unfortunately, when there is a level that they are not performing optimally, they are considered inadequate. And what I really get saddened, what saddens me the most, I think personally, is when a lot of them come because their spouses have pushed them, or their spouses are already growing frustrated because of this problem. So most of the time, unfortunately, those healthy individuals, they come and they ask, they want, because the place where I work, or the place where I offer my services, especially after working hours, in the normal, from the normal working hours outside of that, my practice outside, you find that a lot of them come because they only want one particular therapy. But what people don't understand is ED, or erectile dysfunction, doesn't come with one particular say. It is not like, okay, you have come with erectile dysfunction, this is your problem. Unfortunately, a lot of them resort to taking pills for the erectile dysfunction per se, which is not really wrong. But the thing is, you are not solving the underlying issue. I always tell my patients this: when you want to build if let's say you want to build a road, You want to break everything, make sure that you have a good stone foundation, and then you put your tar layers, you know it will last. Okay. Now, what has happened is that has all developed embryologically. That means embryologically. That means in utero, everything is already formed. But as we age, what happens is the tar root, you get some small potholes. Now, there are two ways to actually fix this pothole. You can actually just go and top up with some tar, and then when you come back 3 months later, you'll find again the same pothole, probably bigger one there. Or you can actually break that particular area, relay the foundation, close it up, and be rest assured that it will last for at least another 5 to 10 years, which is what I like to do. I like to go and identify what is the underlying problem. Because I'll give you a very simple example. Most of the males who come in, the gentlemen who come in with erectile dysfunction, when you check, they're having diabetes. But they've come in for a different therapy, because there are therapies which are called shockwave therapies, which can actually help, but that is through circulatory. Now, when a person has erectile dysfunction, you can actually basically have either hormonal dysfunction, you could be having some underlying diabetes, hypertension that is causing the erectile dysfunction, or it could be a circulatory problem. So there is no point I give you a circulatory treatment, a circulatory problem treatment, when the underlying problem is actually hormonal, or the underlying problem is actually a diabetes or hypertension. A lot of them, when they come in, we check, most of them are having high cholesterol, and that is actually leading to their ED. So I actually told them, they say, yeah, you know what, doc, I've been actually taking these particular medications to approved medications for erectile dysfunction. That means you can buy it is a approved drug by the Ministry of Health of whichever country. That means of Malaysia or Singapore. It's approved drug. That means it is a legal drug. You can actually take it. It will solve problem, but it happens every time. So now what I'm offering them is, I'm telling them, I know what is the cause of your problem. You can do away with these pills, but you need to control, let's say, your cholesterol or diabetes. What is even more worrying is that the bigger problem underlying, like diabetes, is not only going to affect erectile dysfunction, it's going to affect your cardiovascular health, it's going to affect your brain health, or even your circulatory health, or your leg, your limb health, because diabetes is it's a entire disease of the body. It is not only localized to one thing. And the same thing with cholesterol. Today you're having erectile dysfunction, tomorrow you may get a heart issue. So when I'm giving you this medication trying to solve your problem, I'm actually solving another 2 or 3 problems at the same time, which is what probably you are not seeing right now. So I think when we talk about erectile dysfunction, number one is, unfortunately, we live in a society where it's very difficult to talk about. Number two is, even when you probe, sometimes a lot of people get shy to talk about it. In fact, I have to make sure I close all the doors within the room. I have a sliding door to the next room. I make sure I have to close the door, because even if you leave half a cm open, they say, doc, actually the door is still open, So you have to, but you see, sorry?
No, cannot, doctor. I would just,
yeah. So at the end of the day is, we have to make whatever it is possible and how shall I say, ideal for this to come out in the open. But I think if a lot of gentlemen start talking to other gentlemen and finding out whether they're having problems, and you know what, I get a lot of them who actually have this problem, and then they go and ask their friends, hey, you're having diabetes, right? You have this problem. Hey, yeah, every time I have the problem, I take the pill. And then the guy will come and say, no, you know what my doc told me? Actually, if you control your diabetes well, you can actually solve this problem from the root. And you see, in next 2 weeks, the fella is sitting behind in front of my door and asking me, hey, doc, my friend the other day told me that this is the issue. Can you help me out? I'm actually happy. It's not that they're coming to me. I mean, they can go to anybody else, any other doctor, qualified medical professional. Most importantly is to get early help, because you sometimes see so sad cases where they're having erectile dysfunction because of hypertension, diabetes. They are having circulatory problems already. They're having mental problems and issues, and mental health can also affect erectile dysfunction. I always tell people, a lot of people think that erectile dysfunction is not related mentally. It's absolutely false. You can even take medication for erectile dysfunction and still have erectile dysfunction if your mental health is out.
Well said, doctor. Well said. Well said. I mean, it's much more needed for all the men out there. I think when we have these kind of problems, if you do have, then I think it's very important to go and check with your doctors to get these sorted out. I think most of the time it's that actually could be a different factors involved, either psychological or hormonal, or even a blood flow. But it's not a isolated sign or symptom. That definitely your doctor can test for these, and any abnormalities can be treated. I mean, that's what Dr. Arvinda has mentioned. That, I mean, thank you, doctor, for shining light on that. Yeah.
Yeah, also can I add another thing? A lot of
Yes.
people think that only after 40 or 50 years old you get erectile dysfunction. Let me just share with you. I've actually got people in their 20s who come to me, absolutely fit individuals who can run 5 to 10 km a day with erectile dysfunction. So it's not limited to any age. Anybody can get it at any age. The most important thing is to actually seek help. Now, these 20-year-olds that they come to me, they know that it shouldn't be happening this way. So they come to quickly seek help. But unfortunately, when the 40 or 50 or 60-year-olds, they have the same issue, they take it that, this is normal. That's the problem, that this is normal. It shouldn't be happening. Of course, we have to identify the problem. We are trying to recreate your body back to the norm which you are supposed to be at. Yeah.
Thank you, doctor. Thank you so much on that, on the creating of awareness. Even if it's a erectile dysfunction, I think there shouldn't be any shyness. If it's a medical issue, I think it should be sorted out. If not, it will be have to be. It can lead to many other issues as well, right? Unstable relationships, and I mean we know that it can go into different branches of different issues that we can talk about. So thank you on that information. So guys out there, you all know what to do. Okay, we're going into the next topic, doc. I mean, of course, when we talked about this, unfortunately, the cases of atherosclerosis or the cardiovascular disease, it's coming even way much more lower, right? Cardio, especially related to the cardio. So in the past, there used to be have heart attacks issues at the age of 50s and 60s and 70s, and that's what we came to know in the word of mouth, and we get all this news. But right now, scaring issue is we do have. I mean, men are more prone to atherosclerosis, which is the what we call the heart and attack, MI, myocardial infarction. And the age is being pushed down from 80s and 70s and 60s and 50s and 40s and 30s and 20s. I'm sure in your line you have faced many of that. I mean, that's a topic that we're going to go on next. I have a couple of talk sessions with cardiologists in Singapore, and we the same topic that we talked about, right? I mean, the lifestyle, the kind of stress that everyone is going through. We tend to smile and get short happiness by looking at our phones, and we start not communicating. And I mean, that cannot be directly related to atherosclerosis, but stress is also a factor for heart attacks. But having said that, there's also a study that been done that they found out that most of these myocardial infarction happens on Monday mornings. That's probably because you're going to work on a Monday morning. So not sure whether that data is right or not. But the scary part is the age is getting lesser and lesser. So what is your take on that?
So I think one of the reasons why it happened on Monday morning is because of the weekend living, also the way the weekends are lived at. Either there is very high strenuous activities or activities that actually causes strain on the body. To be very fair, I think when people go and socialize, they may actually be consuming more of tobacco, they may be consuming more of alcohol on that weekends, which makes it even worse. The other thing which I would like to bring up at this point is karoshi. Have you heard of karoshi?
Nope.
Okay, karoshi is
What is it,
actually
doc?
a Japanese term whereby people actually die while they are actually doing work in office. It's a very common
Oh,
thing in
okay.
Japan. They call it karoshi. It is they die because they are overworked and they're just doing their work and suddenly they just drop dead. And people don't even realize that they're dead because of that. That's called karoshi. So what has actually happened in the past is because um, cardiovascular diseases, they were officially last time linked with very old elderly age, but unfortunately I have seen even in my practice 20 and 30-year olds coming in with already some amount of cardiac issues. I've also seen some particular patients at the age of 16 developing some side of cancer, colorectal cancers, which also is another thing that males should talk about, especially in the genitalia of the testicles and also prostate and penis, where people tend to actually, elderly males tend to get cancers of that. But unfortunately, it's always thought that elderly people get cancers. I've also seen 20 and 30-year-olds getting cancer of the testis. And the thing is, if you pick it up actually much earlier, the prognosis and outcome is actually very, very good. Diabetes is very, very common. You know what is the youngest ever patient I've seen with diabetes, Vance?
11.
2 years old. I've seen some even, at the time they're born, actually that is because they have insulin dysfunction. But if you talk about type 2 diabetes, where it is non-insulin dependent, or basically the insulin secretion may not be enough and all that. I have seen patients at the age of 9 coming in, and the mom tells me that this guy can just eat and eat and eat and eat, and when he doesn't eat, he starts getting cranky. And when you just decide to do a blood test, you find that everything is out of control. Now, unfortunately, a lot of this affects the males more than the ladies. And this leads to cardiovascular health problems, diabetes, and even mental health, especially those people who have been diagnosed at a very early age. A lot of them take it mentally very difficultly, that, in a very difficult level, stating that, oh, I'm not well, I'm not fit. Straight away, even though the guy may be, I've got a guy who was a weightlifter, very fit guy, came with chest pain. I actually checked, and he was actually having a very mild heart attack. And when we sent him to the hospital, they found there was actually a mild narrowing. And it is exactly to what you were saying, Vance, because when they're actually doing very strenuous activity, how a heart attack happens is, if this is your size of your vessel, the blood flows, everything is nice. Now, with atherosclerosis, or with fat actually collecting, so what happens is it becomes narrow. So from this, you actually find that maybe this is happening. This is what is happening. Maybe you find that this is already closed off. So if you find that this has closed off, you see how small the lumen becomes. Now, if they undergo stress, what happens is the artery constricts. And can you see now how narrow it becomes? The moment that they don't have any stress, or they relieve their stress, it actually opens up. And that is why hypertension is one of the leading factors to actually cardiovascular diseases or heart attacks, because when it actually constricts and there's already a plaque there, what happens is they tend to get heart attacks. Heart attacks is basically when there's inadequate supply to the heart. Now, the reason why plaques actually happen in males is because of testosterone. And when there's a high buildup of testosterone, there's a high buildup. You must understand, whether you like it or not, testosterone has a similar structure towards any steroids, which actually is a fat which actually causes blockage within the arteries. And it can also cause blockage within the penis, of the circulatory of the penis. And that is why they actually have erectile dysfunction. And again, it comes to the fact that a person who's coming with erectile dysfunction may be actually having an underlying cardiovascular disease, which is not prominent yet, but it is already prominent. The erectile dysfunction is telling us that, hey, hello, there's something else happening outside there. And that is what is happening. And diabetes, of course, can affect, I think, males and females these days at any point of time. And mental health as well, because we always think as mental health as a separate component. Oh, that person is depressed, that person is sad. But the sadness and depression may be also caused by other diseases which are happening. Erectile dysfunction is one of them. It could be also because of their diabetes or cardiovascular health. Some people say, oh, I have a cardiovascular health, my lifespan is shortened. But no, a lot of people don't realize that actually by identifying it early, we're actually reducing the risk of events of happening. So I think everything is lumped into one. Unfortunately, we find that a lot of males, it is very difficult for them to come forward and actually get treated or diagnosed, because they always think that, oh, if I'm sick, I can't work. And it's because of society pressure that a male supposed to be working and earning for the family. So I think these are a couple of things which actually is becoming a hindrance for us to ensure better male healthcare in this part of the world.
Very well said, Doctor, on the health part for men. And then I think the cardiovascular coverage was perfectly well said, as well as diabetes and mental health. We just have a last one more topic before we are going to close today's topic as well. Of course, it's we're trying to make creating awareness, but sometimes even in my line or your line, probably you will face this very often. I mean, they have to come and open up to the doctor. Sometimes they are very comfortable. But in my line of work, there's female tend to open up more comparison to a male. I mean, probably because they don't want to show another male their weaknesses. But I think as long you are sharing it with the right person, then we call it the three aspect of safety mechanism. We talk about the gut, we talk about the emotional, and we talk about rational. I mean, as long as you feel comfortable, please have a chat with any of your close friends or family members if you think that you need to speak. I think speaking out is very, very important. I mean, that is where we are now coming to this topic, as well as mental health is such a challenge for men to confront. And especially when we want to make them talk, I mean, sometimes they don't even want to talk about it. That's where all these alpha think, I'm a Achilles, I will never tear down, I'm strong. I mean, you 10 years, you are, we are, but it is very important to show a little bit of emotions on your own side, even if you don't want to show it to someone. It's okay to let it go. You have to let it go, because if not, it's just in a vacuum or being pressure that's building up, and eventually you will just explode. But this is the topic that we are talking about. I mean, in terms of mental resilience, of course we don't have the data, but probably you will have the data for different ways, because you look at it, you read them, and you follow these analysis. But when we talk about men's mental resilience or mental health, how is it we are looking at? Maybe we want to quote something from WHO, or if any of these stats you want to share a little, maybe not so much on deep on it, but what is the comparison between women and men in terms of mental health? Or is it quite equal, or are we looking at there's a huge off balance in the spectrum, in both spectrum?
I would like to answer this question realistically and on paper. On paper, we find that ladies are having more mental health issue than men. Now, on paper, it looks like, oh, that means the ladies are having a lot of mental health issues. No, because in order for a mental health issue to be diagnosed or to even be treated, you have to get people coming forward. So when you have people coming forward, because mental health issues may be very silent, it may be within the individual, especially if they're introverts. So what happens is, you find that if people don't come out, you actually can't actually diagnose them. So what they actually do is, they find that the women are more upcoming or forthcoming to actually be diagnosed or to speak about it. The males are not. But realistically, in this world now, they have screening tools. Screening tools meaning, I don't have to see you, you don't have to see me. I give you a questionnaire. You just do the questionnaire, and immediately within 5 seconds after completing the questionnaire, you will actually know whether you are depressed. One of the scores which Vance, I always speak to you about, is
Yep.
the DAS scale, the Depression, Anxiety, Stress 21 scale. So immediately within a couple of minutes, a freely available scale, it's an open access, anybody can just click, and the moment you find that, hey, that there's an issue, it'll immediately tell you. But that is how you know that you are having it, and you need to go and see a mental health professional to actually get that sorted. But what has happened is, on paper, we see that a lot of ladies are having mental health issues compared to the males. But when you compare screening scores, that means when people come forward to screen, you find that the males and the ladies have an equal amount of having mental health disproportion, having mental health issues. They are in proportion. So unfortunately, in the statistics which we see on paper, you find that ladies are more forthcoming. But I think it is the males who are actually supposed to be
Yep.
forthcoming. Unfortunately, a lot of them come forward when it is already very advanced, which makes treatment very much more difficult. So unfortunately, that is how we look at. And another thing which I always tell people is, some people may not be comfortable talking to doctors, some people may not be comfortable talking to their friends. The most important thing is that you talk to someone. That is why you have a lot of NGOs these days in this part of the world, where you can pick up a phone or you can make an appointment. But of course, these days, I think they either do it online, or they prefer via telephone conversation, where you can actually share out with this person. And this person, he may not be a trained mental health professional, but at least they can speak to you and actually talk to you and tell you that, and convince you that, look, maybe you need to get some sort of professional help. And the thing is, when we actually talk on the phone these days and all that, they don't have eye to eye, face to face contact. Sometimes you find that they pour out their emotions even more. So I work with a few of these NGOs, and I find that it is actually quite effective. So I think if you have exhausted all resources of talking to people, you may want to engage with this type of NGOs.
Even when we talk about this, I think I can relate to this, because it could be a little bit of stigma, judgment that people are worried about. Even when you say that you want to see some psychologists, even for chat, or even if you want to see a counselor, probably the first question they pop up in their mind is, hey, I'm perfectly fine. Why do I need to see a counselor? Why do I need to see a psychiatrist? But we have done a couple of talks with psychiatrists as well, psychologists as well. Even Prof has mentioned a couple of times that the stigmatization is very important, because they always think that they are judging. So is it could be also the pressure of the society? People are always talking. You do something, people talk. You don't something, people also will talk. So is it could be that reason why men are always a little more conservative because they don't want to fall into that category. Do you think that also, but not on the medical ground, but in terms of the social pressure that I'm talking about, is that could be the reason also, doctor?
Yeah, I think society has to understand that, we have evolved as a human race. We have evolved from the men only going to work and coming back and the ladies looking after the families. I think we have evolved into the society where there's shared responsibility, there's equal amount of liberty given to both sexes. And in fact, I think we move forward as a human race. So I think even in terms of healthcare, it should be looked at that as the moment. I think even emotional support, emotionally, whether there's ups and downs, it should be also shared. And I always tell people, I don't think anyone is spared from uh, saying that they are okay when their mental health is a-okay status. There will be ups, there will be downs, but the most important thing is, can you deal with it? And if you can't deal with it, you need professional help to actually deal with it. So I always tell people, it is okay to not be okay. That is the most important thing.
Agreed on. I mean, in the past couple of months, we talk about on different topics about mental resilience. And just on a side note, doc, I mean, I'm always very interested in the human mind. I do my own research on different cases and different ways of behavior, human behavior as well. Very interesting thing. I'm also going to pursue a little bit more on the studies as well. But that aside, but what I think that the melodrama of what we are, sometimes it's very important that if you notice your loved one or your friend is acting very strangely, in his words are not very consistency, he tend to lose weight or rather gain weight. If you do see a sudden change, especially with your loved ones or friends, because probably you will know that. All right, for viewers, I think it's very important that you need to look at the sign and symptoms, that because very important, they could be suffering a different kind of a new environment which they are facing at the moment, but they might not be sharing with you. Because doc, when we even talk about depression or anxiety, even a little bit more on mental related illnesses like bipolar and a lot of stuff, I mean, it's very tremendous. It go through a lot of huge changes in the mind. But I think we shouldn't be looking down on people who are going through these challenges period of time. Instead, we should lift them up. We should give them the guidance. We need to give them the support, just like any other human being. But I think the society, we can't change the society, right? If you try to change the world, you are called a stupid. If you change yourself, you call the smart. I mean, that is how it is. But eh, the point, what I'm trying to make here is, I think everybody go through their own battles at all the time. But if you can stay positive in a negative situation, you won and you conquer the battle. But a lot of people will not be able to adapt to this change because it's a restructuring of your mind. When you react to a certain issues, or a person who's going through a battle, a big fight is going through their whole entire life, they are actually tuned to that, and their behavior changes towards that because you mold them into such, because of your hormones, because of your cells. And we can talk about all the other hormones in the human body, but of course we don't have the time today. But you're actually adjusting yourself, so your character changes. So if you do see your loved one going through these changes in pattern, sign and symptoms, I think you need to bring up the red flag and then talk to them. Probably they will deny it, but you need to find ways and means to get the help to them, because if you don't, the chances of them going into deeper into that stage will be even higher. So, doctor, correct me if I'm wrong. A person who can easily fall under a depression when they're feeling stress, when there's no outlet, activities are gone, especially during this pandemic, they can't do anything. And I'm sure this is happening
Lockdown.
on the other side of our beloved country, in Malaysia. I think a lot of people love that. A lot of people are get stuck there for 1 over year, 1 over year plus 2 years right now, lost their loved ones, can't visit them all over the world. The whole world is going through a tremendous challenge period, right? Quarantine has now become from 7 to 14, even 3 weeks at certain place. So it seems like a prison that you never went before. You're isolated in 4 walls. So people are going through huge changes. I think communication is very important. Observation is important. Sign and symptom is important. With that, I think probably we can get evolved better as a human beings. I mean, that's the whole idea. The biggest and the highest form of living creature in the world. I like to use the word creature. We are the
One
human
more,
beings.
yeah. One more thing is destigmatization.
Yes,
Don't
yes,
stigmatize
agree.
everything. everything starts with stigmatization. The moment somebody walks into a psychiatrist's office, oh, that person is not correct. But the thing is, that person may be having depression, or the person may be having anxiety. It's so common to have anxiety. But the way medicine is structured is that these particular patients are dealt by a psychiatrist, or even a healthcare professional, a GP, or a primary care doctor. So, that is why I always tell people, empower the primary care, because when you empower the primary care, you may be sitting outside for a cough and cold, you may be sitting outside for your hypertension or diabetes, you may be sitting outside for a mental health issue. So the destigmatization reduces. But I think when we refer cases or patients who are actually quite severe, when they are reluctant to go because of stigmatization. So if we destigmatize, we are actually going to hit the root of the problem. And this is where society can be. Think what you want, but don't say what you want, and don't show what you want in the sense of when it comes to mental health. Because whatever you say, whatever you think, if you're not careful, you are actually affecting somebody else's health. You may say and walk off, and that's it. You carry on with your life. But that one particular sentence will make a world of difference to that person. You say a nice thing, it may prompt the person to get help. You say a nasty thing, it will actually bring that person down. Very, very important for us to understand destigmatization and acceptance.
G, you exactly. I think probably is one of the Guru Nanak's one of the teachings. I think be a light on another human being rather than be a
Yeah,
wind blowing off the candle in them. I think for those who are probably, I will not use the word suffering, but those who are going through their battle, going through their hardship. I think the hardship and battles are the one that make you stronger. But you got to fight on. It's not easy stepping into other people's shoes, or if you are in your own shoes, you know the pain. But if you can stay, I mean, so like I said, if you can tune yourself, mold yourself to be positive in a negative situation, I think you can conquer it. I mean, at the end of the day, our life, all of us are going to perish eventually from this planet Earth. So there's no point to get things serious. Take life as it is, enjoy the moment. That doesn't mean that you spend lavishly today and think that, oh, I don't care about tomorrow. It's not about that. But I think you got to love. You got to send love, give love, receive love. Don't worry about the society too much. That's what I always, whenever I give a talks or even in my talk shows, that don't worry about the society, because at the end of the day, society will talk eventually, or even when you're not doing anything. So put them aside. Very important. Stay circulated with positive people. If there's a people who are just naysayers or discourage you or throw you into different circumstances, I think that is a time that you need to gun them down. When I say gun them down, not really gun them down, but cut tears with them and move on with your life, because you have only a limited life, probably not even 100 years, doctor, because right now the human life, if you look at it, before 70, probably above the 80. I do not have the stats, but not much, not
75.
much. 75, yeah. So we
Mm.
need to live life blissfully. So be happy. If you think that you are not happy in certain situations, you can make the changes. Only you can make the changes, because you have all the rights of how you want to live. If it's going to benefit other people, give it so much of love and receive so much of love. But if you don't, with toxic people around you, I think that is a time that you need to move on, because you can't carry baggages when you're moving forward, because it will slow you down, it will weight you down. But instead, like what Dr. Arinda said, it's a way of how stigmatization works. So we all have to be prepared. So I think mental resilience is a very, very important topic. Doctor, if I'm not mistaken, I think mental resilience topic, I think we have covered. Wow, I lost count. I lost
Yeah,
count, but I think we covered so many topics on mental resilience. And
correct.
I think we're
That's right.
still covering about it, right? We are still covering on this
Yeah,
topic.
yeah. Mental health,
Uh,
mental resilience actually is a long, big topic. It changes with time. Like we spoke in the past, that even mental health has evolved because of our gadgets and mobiles. Those days, we face people and that's it. We come back home and that's it. We are disconnected. But now we are connected all the time. When the moment you open your eyes and you decide to start your phone, or you on your phone or connect to the internet, that's where it starts. So unfortunately, it comes at a price, and also with mental health. So I think mental resilience, the art of calling it or where to draw a line has become a real art these days. And I think validity of mental sanity has to be taken on onus of oneself on where to draw the line. So I know a lot of people these days, when they're on social media, they post, they refuse to read the comments anymore, because when they read comments, they actually get depressed and sad. I think I heard a couple of talk shows before on mental health where they invite celebrities, many celebrities. I can't actually pinpoint one because there's so many, that they stop reading their comments because of all the bad and sad things that people say about them. So they just have to say what they have to say. And it, I think, has also made them realize that whatever they are posting, they should not offend anyone. I think that is the step that everybody should take, that I'm going to post or say something, whether it be on social media or in face, I'm going to say something. Let's say if I was in the other person's shoe, would I like that? And then make your decision from there. That is the most important thing.
Thank you so much, Doctor. I mean, I'm just waiting for the borders to open up. I'm going to either swim over, which is of course can't be done, fly over. I think that's the best, or drive down. We got a lot of things to catch up. Same synchronization, different topics, different seminars that we have planned for. That's going to happen in Singapore and Malaysia with Kopi With Vans. Then thank you so much for your valuable time. I know with this 1 hour of talks that you are coming in very regular, you probably could be resting, because I always know how your schedule works. I know you literally jump in to your seat, and I know that from the backstage. Thank you so
Yeah.
much for all these magical things that you do for viewers to come in as a regular speaker. Thank you so much, Doctor. Thank you so much.
Most welcome. Vance, do we have any questions which the audience wanted to ask, or we have covered everything?
Um, oh yes, but I'm not
There was
sure
a
if you're going
question.
to take that because
Mhm.
let me see the face. Oh, can we? I mean, I know we are running not say late, but of course we try to keep within 1 hour. But if we can just answer that in, I know it's going to be very tough to ask the doctor to explain within 2 minutes, but it's a humble request, doc. If you can do that,
Sure.
because I don't want to hold you back. It's a quite a okay. I just bring it up to you. So thank you, Deepam, for that question that you posed. So let's see if doctor can able to answer that within the next couple of minutes. And it's my fault. I should have bring up that question earlier. All yours, doc.
Okay, no problem. Thank you, Deepam, from a great question. I think it's a fantastic question, and I will just keep it really short. You see, whenever we talk about health in women, or even when there's a government program or a screening program, most of the time it comes with either a mammogram or it comes with an ultrasound of the breast. So that is why there are many women that face breast cancer, who they know about it, and you find that the rate of breast cancers, a lot of survivors are there who come and talk about it. But a lot of guys actually don't know that they're having prostatic cancer, because I think the screening is not as much, because by the time they reach the age of actually having prostate cancer, they probably are not on any medical care support, or they choose not to go and see a doctor, or at the same time they can't see and feel. Breast lumps, basically, to be very fair, if you do a self breast examination, you actually know. To actually know about prostatic cancer, you need to either do a blood test, or you need to go and get a medical examination done by a doctor. So unfortunately, I think there are many men with there are two types of prostatic cancer. One is the fast moving type of prostatic cancer, and one is the slow moving type of prostatic cancer. So for the slow moving type, which we used to see in the past, a lot of them die with prostatic cancer. They don't die of prostatic cancer, they die with prostatic cancer, which is a very different thing. But these days, there's the very fast moving one that it spreads so fast and they actually die. Probably they will come with cough. You take an x-ray, you find that there is a lesion already in the chest, and when you investigate, it actually originated from the prostate. So I think that is also picking up, and I think the way to actually move forward is awareness of males to actually get a proper prostatic and male examination done, or at least minimum to actually take their blood, which is called the PSA, prostatic specific antigen, to actually find out. It may or may not be very accurate, but of course with the examination, and of course with the proper male genitalia examination by a medical professional, we can actually get there and find out at a very early stage. So yeah, I think there are as many, but probably they're all gone undetected, and that is the problem.
Thank you so much, Doctor, for that great explanation. That one of the fastest answer you ever given. That thank you. I know you are a very detailed person. So thank you so much. We are going to come back again on a different topic. Of course, we are still discussing on that in the upcoming weeks. But thank you so much again, once again. Thank you so much for joining
Most
me at
welcome.
Kopi with Vans, Doctor. Thank you so much. Have a pleasant evening.
Thank you, everyone. Stay
Thank you,
safe, wear
Doctor.
your mask,
Thank you,
SOPs all the while. Thank you.
thank you so much. All right, viewers, it's almost 1 hour, 20 minutes. And thank you for all the viewers that's staying tuned. And these videos, or rather, this live streaming will be placed in all our social media, which is YouTube and few of the Facebooks that we have in different groups, which is Kopi with Vans and Fin Mantras, as well as Vans. So thank you so much for joining the past 1 hour, 20 minutes. I hope this session on men's health will be definitely worthwhile that you have attended. And if you do see your friends that probably need some help, like I said before, you can share this video with them. And I think the most important part at this point of time, where we're all facing a biggest challenge, and I've been saying this quite regularly, the biggest and invisible enemy that we need to defeat, we will definitely get it defeat as long as we all play our part. But also there's a cases that also can be related to stress and depression and anxiety. I think that is also could be on the rise. Like I said, I don't have the data, so I can't comment on that. But based on observation, based on speaking, I think all of us are stressed at some point of time in our life. So I think it's very important that we need to turn inwards and look and repair within us rather than looking outwards and getting validation from people, judgments. So if we are going to live life based on their judgments, whoever it can be, right? Can be your friends or families or whoever, then your happiness, your sadness, your anger, your emotional is depend on other people's judgment, other people's comment, or other people likes or dislikes, so that you are being manipulated. So I think that is very important. Even when we talk about mental resilience, I think we all need to stay blissful, live happily, and most importantly, live within the present, not in the past. You can go back to the future, not back to the past, but go back to the future and come back. All right. We don't want to do anything in the past. With that, I'm going to sign off. This is Vans from Kopi with Vans again. Thank you. So I'll see you next week on a Tuesday as our lifestyle show at 9 p.m. and a health topic session on Wednesday at 9 p.m. Signing off. Have a pleasant evening. For now, sayonara. Bye bye.